What's your stance on the position or the condition of mental health right now in Fiji, and where are we right now?
That's a very good question. It's a question that will take us days to discuss. Where we are at with mental health. I think it's only after COVID-19 that we start to bring a lot of focus on mental health and how important mental health is to everyone, not only in developed countries, but also in developing countries. And mm, we've all gone through that experience, and we know how difficult it was to make a lot of changes within such a short time, and having to adjust. And a lot of people had difficulty in adjusting. Some were able to adjust very well. And we can say it was a lot of stress. We did go through a lot of stress during that difficult time. People then started to value the important, the importance of taking care of the mental health. And, we start to see, and we see that in public platforms like Facebook and Instagram, short videos about how to look after yourself when you are being isolated. There's restrictions of movements and people losing businesses and losing employment and people falling depressed and getting anxiety attacks and panic attacks. And so then people started to notice that, yeah, this is such an important aspect of health that we should be taking care of. But to comment about mental health service in Fiji, it has come a very long way. And, we have one tertiary mentally health hospital or psychiatric hospital, which is St. Charles Hospital. And we also have, our private practitioners. We have the health centers and the nursing stations where you have health professionals available. But to really understand, the different types of mental health conditions that we have here in Fiji, I don't think a lot of people do understand them. Because before that, I think a lot of people have a view of mental health as such a Western, you know, uh, Western ideology. We don't recognize it as an illness entity here in the Pacific. Yeah, so I think we would probably discuss about that much more later on. So I don't know. What do you think about yeah, this issue?